To 12 minutes past 9. A very good evening to you if you've just joined us. You are listening to Africa World Hour here on Channel Africa, the African perspective. Now, let's tell you about one of the stories that we're looking at. We've been pretty much speaking about it over the weeks, over the months, as these developments continue and they worsen. We're looking at the plight of Sudan's children. They're facing a deepening crisis, with UNICEF now warning of irreversible harm if urgent action is not taken to reach them. Millions are at risk due to the ongoing conflict and worsening living conditions. Access to basic services like food, healthcare, and education is becoming increasingly limited. Joining us now to speak about this is Sheldon Yett, UNICEF's representative in the Sudan, to share what's been happening on the ground. A very good evening to you, Sheldon. Thank you so much for speaking to us. I believe the description of these children in particular has been that they've been reduced to literally skin and bones.
Absolutely, and nice to be with you. I'm actually joining you from Port Sudan. And indeed, Sudan is a massive country, as your listeners know well, but we have these pockets of malnutrition, pockets of famine. And in those pockets, these children are in extremely poor shape.
Mm. And just talk to us about the areas that you've covered. As you mentioned, Sudan is a very big country, and some of these regions are worse affected than others, or countries, should I
Absolutely.
say.
Absolutely correct. I mean, the Darfurs, for example, a region which is roughly the size of Spain, give you an idea of how big it is, particularly hard hit. Many of the epicenters of malnutrition are there. I just came back from Khartoum. One of the neighborhoods there, Abu Julia, or Jabal Aurelia, is one of the two localities in Khartoum state which has been identified at being at extreme risk. It was an area that was really in the center of conflict, and where children were cut off for many, many, many months. And now we have access, and we're seeing massive demand from mothers wanting to bring the children for basic nutritional support.
Mm. And speaking of access, that's not even easy to come by, because there are vast tracts of desert land for some of these women, children, or displaced people to reach. So tell us about the level of access in the face of not only the continuing conflict, but also reduced aid.
Well, exactly. And it's not just that, it's also the fact that Sudan, as we mentioned, is such a vast country with very poor infrastructure. And we're now in the beginning of the rainy season, and roads that are passable in one day become massive lakes on the following day after a heavy rain. So that makes it difficult. We also, of course, need to negotiate with the government and all parties to the conflict to get our supplies where they need to go. We can't just put 60 tons in the back of a truck and go. You need to get permission. That takes time. That takes lots of negotiation. We have to often negotiate our supplies across lines and across borders.
Mhm. And how many, if you are able to tell me about some of these health centers that you perhaps manage or are able to set up, whether some of them are mobile or not, are you able to help or even treat, say, within a day or even within a monthly period, the numbers that you're seeing?
Indeed, it really depends on access there on the centers. What I can say is that we have health centers run by our partners, run by the government of Sudan, run by others all around the country. The issue is not their ability to treat per se, but the ability for women and children to get to the centers, and also the steady flow of supplies. You had mentioned the aid cuts. That has had an impact on us. It's had an even greater impact on our partners. It means that the continuity, the supply chain, is not as strong as it could be or should be.
And the infrastructure has also been continually decimated over the past couple of
Absolutely.
months as a result of the conflict. The situation is clearly dire, as you keep warning, and every time I have conversations with aid agencies like yourself, I keep asking myself just how much more worse can it
Yeah,
get? So talk to me
yeah.
about what you're seeing, what you're anticipating.
I mean, it's pretty bad, and I've been in in emergencies all around the world for some 30 years, and this is one of the most complex ones and one of the most difficult ones to provide the kind of support. And I'll be frank, as long as the fighting continues, we're going to see more of this. We've passed the second year anniversary, we're into the third year, and the conditions get worse by the day. As long as health centers are hit, as long as schools are hit, as long as markets are hit, as long as children, families are hit, I'm afraid that we're going to get far worse conditions.
And Sheldon, I don't want to be pessimistic. We always bank on hope, whether it's now or in the near future. What would help alleviate the situation? We were talking about an outbreak of cholera not so long ago, water infrastructure having broken down. So it seems like a hopeless situation.
I don't think it's hopeless. It's never hopeless. But unless we have an end to the conflict, unless we have guaranteed access, unless we can get our supplies and our people where they need to go, unless they can be there for sustained periods, then yes, it's very difficult to provide the support and assistance that the children of Sudan urgently require.
We've spoken about many obstacles. A lot of them are big obstacles. What is the main one just in the near future if we're going to see a significant turnaround in the challenges that you're facing?
Again, it comes to access. We need to ensure that we get our people on the ground where they need to go, that we get our supplies where they need to go. Sudan is a vast country. Most places we can access. The hotspots are very difficult to access. I'm sure you've heard of ongoing siege in Al Fashir in North Darfur. We've been trying for almost a year now to get supplies to those areas. It's really, really, really difficult.
And what you need also is political will and intervention to protect healthcare workers, volunteers who are trying to alleviate the plight not only of women and children, the elderly, but those who are infirm as a result of injuries of war. Are there... Go ahead.
Go ahead. No, please.
No, please. I was going to say, are there negotiations underway? What hopes are there of getting an ear of someone to help protect healthcare workers or volunteers?
Well, it isn't just healthcare workers, it's teachers, it's all humanitarian infrastructure. And of course, targeting humanitarian infrastructure is a violation of international humanitarian law. We need to keep people accountable. We need to remind people of that there are consequences to doing this. Yes, we talk as UNICEF to those who are parties to the conflict, but of course, the violations do continue, and we need to see an end to these violations. We need to see those people who are conducting them, held accountable.
Well, Sheldon, thank you so much for speaking to us, and we wish you luck and courage as you continue about your work. Sheldon, Yett is UNICEF's representative in Sudan, urging the world not to look away as millions of children face a deepening crisis. And as you know, here on Africa World Hour, it's something that we have been updating you on a daily basis, and it's quite heartbreaking to see and report on. And here's to hoping that the situation does turn around sometime soon.
Channel Africa, where every moment is an African celebration. Feel the energy, feel the connection. Channel Africa, the African perspective.